Ototoxicity. It's a condition that often flies under the radar, but has significant implications, especially for patients receiving certain medications. Today, we'll dive into the three groups of ototoxic agents, their mechanisms of action, and how to manage and diagnose ototoxicity. Ototoxicity refers to ear damage caused by certain medications or chemicals. This damage often targets the sensory hair cells in the cochlea or vestibular system, leading to hearing loss, tinnitus, or balance issues. Importantly, the effects can range from temporary threshold shifts to permanent hearing loss. Let's start with the first group. These drugs cause temporary effects like transient hearing loss due to their impact on the stria vascularis. Loop diuretics, such as bumetanide and furosemide, are classic examples. These agents disrupt the delicate ionic balance in the cochlea, but cause no long-term damage once the drug is stopped. The second group includes drugs like salicylates, e.g., aspirin and quinine. These impair the function of cochlear hair cells, leading to temporary threshold shifts and sometimes tinnitus. The key point? These symptoms are reversible upon stopping the drug. Now, the most critical group, drugs causing permanent hearing loss. Aminoglycoside antibiotics, like gentamicin and streptomycin, and anti-tumor agents such as cisplatin fall into this category. They kill hair cells in the cochlea, leading to irreversible damage and vestibular dysfunction. Industrial chemicals like toluene also have this effect. Why is this damage permanent? Mammalian hair cells don't regenerate. Each group's mechanism of action is unique. Loop diuretics interfere with ion transport, altering cochlear homeostasis. Salicylates and quinine impact the hair cell's ability to transmit auditory signals temporarily. Aminoglycosides and cisplatin generate free radicals that destroy cochlear hair cells and surrounding tissues, resulting in permanent damage. Diagnosing ototoxicity requires vigilance. Patients may present with sudden onset tinnitus, hearing loss, and balance issues. Tests include audiometry to detect hearing thresholds, vestibular function tests to assess balance, and otoacoustic emissions, OEs, to check hair cell health. Managing ototoxicity focuses on prevention and early detection. Monitor high-risk patients. Audiometric monitoring is crucial for patients on aminoglycosides or cisplatin. Dose adjustment. Use the lowest effective dose to minimize toxicity. Consider alternative therapies. For example, switching to non-ototoxic drugs when possible. Emerging strategies. Antioxidants and protective agents like sodium thiosulfate are being explored to reduce cisplatin-induced damage. Unfortunately, for patients with permanent damage, hearing aids or cochlear implants may be the only options. Understanding ototoxicity is vital for preventing lifelong disabilities in vulnerable patients. By recognizing the agents involved, their mechanisms, and how to monitor and manage these effects, we can make a significant impact on patient care.